All right, so this is part two of the clinical case presentation that I've done on a patient that I've seen at my externship. To recap, this is the profile of the patient that I chose to talk about. He is a 2-year-old male, some background on him, unremarkable birth and no family history of hearing loss, but is speech delayed. When he first showed up to audiology, it's because he had not passed his newborn hearing screening. We saw him a few times. We got flat temps, absent DPOAEs, and pretty unreliable VRA as we were testing him. They came back maybe 3 or 4 times. Um, we sent him off to ENT because he was having some middle ear stuff, some ear infections, and those flat temps. The ENT decided to give him PE tubes to help with the drainage of his middle ear. After that followed up, after his ears were cleared and the temps showed a large ear canal volume, meaning the tubes were patent, we continued to try behavioral testing via using VRA, and he was still inconsistent. And so that's when a sedated ABR was recommended to finally get a full hearing test and really determine what um, this kid is hearing. And that sedated ABR showed a moderate to moderately severe hearing loss in the right ear and a severe to profound hearing loss in the left ear, both sensory neural. As soon as that was diagnosed and the parents were counseled, he was fit with bilateral BT hearing aids pretty quickly, and since then, he's been wearing them, and so far, he's noticed some good benefit from the right ear, according to his parents. So, some updates on this patient. He uses his hearing aids every day. He will ask for them in the morning and he'll point to his ears. The parents have noticed that he's been more vocal and been imitating more words and sounds around the home. Um, and he is currently in the process of a cochlear implant process evaluation. We recently did another sedated ABR slash MRI to confirm the profound sensory neural hearing loss in the left ear. The ABR was to confirm his hearing, and the MRI was to see his cochlear anatomy to see if there is a nerve and if a cochlear implant is even possible or medically recommended for him. And so we are currently awaiting those imaging results by the ENT before we conduct a CI evaluation and to see what are the next steps from there. The question that I got from Sydney was about what the parents would do if they decided to not move forward with a cochlear implant. So I'm assuming this is if he is a candidate, but the parents are not keen on doing the cochlear implant or pursuing that for him. The recommendations and next steps for this patient can look like a lot of different things, and it would take a lot of counseling with the parents and the family. So first and foremost, we would optimize his hearing aid use. So we would see him for regular hearing tests and for hearing aid checks. We would adjust the programming based on his age and his different listening needs. And we would also consider some assistive listening technology once he gets into classrooms and we need FM systems and um, mini microphones, different things like that to give him the best listening environment possible with that right ear that does have aidable hearing. Early intervention, of course, he is in speech therapy now, but we would continue to encourage him to do that, do um, some listening therapy to teach him some communication strategies with that right hearing loss. Family support is another big pillar. We would counsel the parents on realistic expectations, communication strategies, and long-term management because that left ear is would not be functional and is not as aidable as it would have been if there was a cochlear implant. Having realistic expectations for the parents is important and um, giving them a uh, giving them a realistic timeline and expectations for what kind of difficulties he will have in classrooms and listening in noise and localization and things like that. And then lastly, ongoing monitoring. Because we are not pursuing anything for that left ear, we want to make sure that his right aidable ear is taken care of, that we are not seeing a drop in thresholds or in hearing sensitivity or any fluctuations, whether that be conductive or sensory neural. So we would do, of course, a lot of different testing. Um, to follow up and make sure that we are giving him the best listening environment that we can and giving him the best tools of amplification for that right ear. And that was the question that was given on mine. And so I will keep you guys updated on on what he pursues. And thanks for listening.